Are you a mom who loves fun, momming, and protecting your family? If you want to meet some of the most amazing people from all over the gun world and beyond, you are in the right place. Tune in for encouragement and sometimes just courage for moms and women just like you, who are curious about shooting but are intimidated or just don't know where to start. Hey, all you tough mothers out there. I have an amazing guest today. His name is Phil Schafer. He is a family and acute care nurse practitioner, serial medical entrepreneur, husband, dad, amazing human being, and my personal hero for many, many reasons, which you guys are going to figure it out. Phil, can you tell us a little bit about what you do and how you change lives?
Sure. So I'm a family and acute care nurse practitioner. I've been working in the hospital for a long time, and I discovered hormones personally, and I made it my life mission. All I do now is balance hormones, optimize hormones, and help people look and feel their best from the inside out. It's not what I do for a job. It's what I do because I'm passionate about it, because it's personally changed my own life and the lives of many of the people I work with.
Yeah, so I'm really excited to share this because a lot of people ask me like, well, how do you stay so like fit and trim and healthy? And I cheat. I have my hormones balanced by Phil and his amazing team, and it has been absolutely life-changing. I went from my health declining and energy levels declining. My body hurt all the time. I couldn't seem to like lose the weight. I was just exhausted and emotionally like just all over the place. And through hormone replacement therapy, I have been able to just regain my life. And it has been absolutely transformative and crucial for just not only my physical well-being, but my mental well-being. And Phil, you've been doing this for a little while and seeing some crazy results, but can you explain a little bit like what it is? And because a lot of people kind of get a general idea, but they're not sure exactly what it is.
Absolutely. So especially women, the first thing to go with the hormones is testosterone, and it starts about age 30, and that's when they start to see a decline. And when they're having babies, they'll see the decline even quicker. So women's hormones scared the heck out of me for the longest time because there's so many more hormones to balance than men. Men, you just increase the testosterone to high levels. Women, you have to deal with estrogen, you have to deal with progesterone, you have to deal with testosterone. And you also have to treat women differently. So you would treat a woman that's postmenopausal different than a woman that's perimenopausal or transitioning, different than a woman that's still having regular periods, different than a woman that has a hysterectomy versus a partial hysterectomy. So it gets very complex very quickly. And messing with a woman's hormone can be quite scary, because if you mess it up, like if you gave estrogen to a woman that's still menstruating, they go crazy. They go absolutely crazy because their body is already still producing it. So I'm very careful with female hormones. What I primarily do with a woman that's still menstruating is we optimize testosterone. We bring you to the high levels of testosterone. This helps you feel better. This helps mental fog. This helps your metabolism, increases your metabolism. I won't never forget when I first met you. You said, I want to be at the high levels, or I don't even want to come. And so I had to think about that because I had to think about that. But you came at me with knowing your own body, knowing how you felt, knowing what you wanted, and you are a high performance person. And so you function very well at the high level. So what is the high level? We can go basic here. A normal woman's testosterone level is between 6 and 80. Women start to feel really, really good greater than 80. Okay. Some women like to be in the 200s, 300s, and 400s. I won't mention any names, but
yeah, I think it's a personal journey for each woman, right?
Yeah, and it's a journey that I have to figure out, and everybody's different. I tell it based on your symptoms. I tell it based on your weight. I tell it based on your build. If you're an athletic person and you are working out every day, the testosterone metabolism is based on cardiac output. So if you're working out a lot, you're going to be pulling in more more testosterone to your blood than somebody that's just sedentary. So you have to pellet according to somebody's lifestyle and their weight and their build and their symptoms. Like, what am I trying to? What are their symptoms, and what do I got to do to optimize them? Some people it's thyroid. Some people it's testosterone. Some people some people have Hashimoto's disease, and so you have to decrease inflammation of the thyroid before you can optimize those testosterone and thyroid levels.
Yeah, I think it's one of those things where there's a lot of nuance to it based on each person. Clearly, I'm not a medical professional, just my personal experience. Like you said, I was in probably my mid-20s when I realized that my body had stopped producing all testosterone together, and I just felt frail and really just everything hurt all the time. And so they figured that out, and then they started me on like the testosterone pellets. And for those of you listening, pellets are they're like these tiny little, they look like grains of rice, and they just like put them into like your kind of glute hip area, and then you're kind of done for a few months, which is amazing. There's no like daily maintenance, at least for me. And then as I got older, I actually went into premature ovarian failure, but I didn't know. And so then my body continued to get kind of wonky and crazy, and ended up having a complete hysterectomy, ovarectomy, and needed to be on hormone replacement therapy. And at that point, that was when everything got better. Because not just the testosterone, but the estrogen, the progesterone, all that stuff was kind of like leveled out. And I had really regained my life through that process. And then I moved out of the city, and that's where I discovered Phil and Artisan Aesthetics, and thought, all hormone pellets are kind of created equal. It's all the same, but I was wrong. The experience that I had with you guys was far and away way better than what I had before. So I knew that I functioned higher, functioned better at a higher testosterone level. And I knew that that was okay for my body, but you guys being willing to kind of like work with me and figure out that right balance has been huge. And then you added on some other supplements, and you figured out my thyroid, and has been just life-changing for my energy level and just like overall well-being. And the experience was like far less painful than I had before. So can you like explain? So a lot of people don't know that there are different methods of hormone replacement. Can you kind of explain what you guys do and what the benefits are for each?
Yeah, so there are cream, there are pellets, there are injections. For men, I'm treating men. I mean, a lot of people have husbands, so I can speak into that a little bit. Men, I primarily put on injections. And the reason why is that the normal level for a man is between 300 and 1200. You pellet a man and you get him up to the high level, the jump from 300 to 1200 is big, massive. And it's based on cardiac output. So if you're working out a lot and then your pellet is metabolized quickly, men get very, very, very upset if you go from 1200 back down to 300. And so I primarily do injections for men because I can keep them at a very high level. Women, the jump from 10, 15 normal levels to 80 or 100 is not as high. So they feel much better at those levels than a man would. So it's not as hard to maintain the higher levels for a woman. So there's that, and there's pros and cons from every single modality. There's the creams a lot of women put on, but you can't control the dose very well with that. Plus, it gets on your partner, it gets on your dog, gets on your clothes. Very hard to control your levels of cream. Injection's really good for a woman's libido, but it makes them grow hair all over the place, and it's hard to balance their levels well with injection. So we did our research, and we found that pellet's the best way to go in balancing women's hormones. So for testosterone, we do pellets. For estrogen, we do pellets. For progesterone, we do oral. The studies have shown estrogen, it's really hard to get into the bloodstream with the oral, but you can definitely get in the bloodstream with estrogen with pellets. So that's why we chose. I mean, this has been going on for 15, 20 years, so they've dialed it in. I'm wearing the t-shirt for our pellet company right now. We partnered with Avexipel. They have it down to a science. They know pellets and they know how to optimize hormones. And I've spent the money to be educated by, I feel, the best in the country. This company has the least amount of extrusion rates in the country. And extrusion is when when you stick something in somebody's body, your body wants to kick it out, right? Your body says, hey, what are you doing to me? Get out of my system. And so this company was brilliant. They coated all their pellets in steroid called triamcinolone, and it decreases inflammation around the pellet when you insert it. So your body doesn't want to kick it out. Like, oh, you belong here. It suppresses the immune system, so you're not going to want to kick it out. And so because of that, and because of their techniques, they have a lot of very, very few extrusion rates. Because sometimes if you don't use good technique and you enter in a pellet wrongly, your body will kick it out. You'll get an infection. You'll have what looks like a massive cyst around your pellet. I don't know if you've ever experienced that prior to me, but it is a horrible experience. You have to be on antibiotics for 6 to 8 weeks. Your body is it's just not worth it. So I just wanted to make sure that any pellet that I was going to put into a person that I could stand behind and know without a doubt, or I want to minimize the risk. I don't want these pellets coming out.
Yeah,
so
no,
what I've chosen.
Fortunately, I never had that experience, but I had heard of it. With any kind of like medical procedure, there's always certain risks, but minimizing it by using, the best available tools and procedures that you can, and medications, definitely highly recommend. I just think that, it's one of those things that hormones get overlooked quite a bit. And we just accept as we get older that we're just going to not feel as good. And we're just going to get tired more frequently. We're going to have mental fog. We're going to feel exhausted in the middle of the day. And that's just getting older. And it's, like you talk to any woman who has kids, young or old, and it's like, I'm tired. I don't sleep well at night. I'm exhausted. I've lost my sex drive. Like there's a lot of different things that are kind of like included in that. And it's like, yes, you do have a case of mom, but you also may have hormonal imbalances that are just really screwing up with your life. And they don't even realize that that's an option because it's usually overlooked, right? You go in for your well woman and you're like, well, I get all these other things checked. It's like, great. I don't have cancer. I don't have this. I don't have that. But the underlying, like, I think the foundation to like your well-being is like grossly overlooked by most of the medical community. And now we're kind of like seeing this like hormone thing come out and people are like, oh, I get it. Like I can actually turn the clock back and feel like I did when I was a kid, which is huge. And obviously you can't share information about clients, but like what has been like the overall like reaching like theme that you've seen with people going from like, I'm not on hormones and I want to be, to like now?
So right before I started this coming into this podcast with you, I met with a woman and a man, and they've been going to doctors for the past 10 years trying to figure out what was wrong with her. She was exhausted, had major brain fog, no libido. They were on the verge of divorce. And I received texts from them. So thank you for saving my marriage. Thank you for saving my sex life. Thank you. I feel so much better. I'm excited about waking up in the morning. I can't personally think of any better medicine. There is nothing else that brings me more satisfaction than receiving texts like that. And hey, we're making changes. We're helping people feel better. So as a nurse practitioner, I worked in the hospital and I worked in the ICU on the other side of medicine. People that didn't take care of themselves all their lives, that have tons of comorbidities like diabetes, hypertension, that they didn't manage at all. And they come in and I just put Band-Aids on them. I fix them up and send them out, and then they're back in the hospital. But if I can get on the other end of wellness and help people feel good and look good and want to be excited about their own personal health, or at least jumpstart it, the chances of them ending up in the ICU at the later end of life is much less.
Yeah,
I don't want to be 70 years old or 80 years old living in a nursing home. I want to be out skiing and chasing after my grandkids, and chasing after, my kids, and being able to trash talk them at 70 years old. So anyway, I think that's kind of reversing the age is a big deal. It's fun medicine.
Is there like an age in which case, like, because obviously once you've reached 70 and you've kind of let your body deteriorate to that, can you retroactively fix it? Or is there a specific age where you're like, this is the prime age that you really should be checking so that you can stave that off and not have that frailty and like lack of life at 60, 70, 80?
I would say after 30. If you're, I give a symptom checklist. If you're feeling increased mental fog, low libido, absolute exhaustion, vaginal dryness, those types of things, I can help you. And after 30 is a big thing. And then I treat. I have a 75-year-old patient that gets her pellets every single week. Every 4 months on the dot, and she says I changed her sex life. I mean, her husband says to me, her husband says that he gets calls from work from her to go home because of her libido, and he's like, I haven't had a sex life like that in 18 years. No, this is amazing.
He's sending you gift baskets, super excited. His friends are calling you. What did you do?
Exactly.
That's so
80
cool.
years old. That's the way I want to be when I'm 80 years old. I mean,
why not?
Short
right?
To not feel awesome. Yeah.
It's one of those things as you get older, you're like, oh, 30, like when you're in your teens, you're like, oh man, anyone in their 30s is like half dead. And then you get into like your mid 20s and then you're like, 30's not so bad. And now I'm looking at the last year of my 30s and I'm like, 40's okay. And then I'm going to get to like my mid 40s and go, all right, I'm getting close to 50, but as you get older, like it doesn't seem that much older anymore. But from like a long off, just, from a perspective of far away, it seems like it's forever and a day, but it sneaks up on you. And yeah, like you just don't want to lose your life, like as you get older and like accept that you are getting older and everything is kind of falling apart, because at that point, I feel like it's too late. So I will be that 80-year-old woman in your office getting pelleted.
Now, can I speak to you about the whole hysterectomy thing? You mind?
Yeah, absolutely.
Okay, so how old were you when you had the full hysterectomy?
I was 30. Let me think. So it was 5 years ago. So I was 34.
34 years old, and you had both oophorectomy, so you had your ovaries taken out, and your uterus, right?
Yep.
Okay, so everything. You're not producing estrogen. You're not producing testosterone. So big deal. And a lot of OBGYNs will not give replacement to a woman at 34. Did you experience that?
No, I was really lucky. I had a really good doctor, because before that I had gone through 4 years of infertility. So I had multiple surgeries trying to like fix what was wrong, and doing all of these different treatments and everything. And then finally went to like an IVF specialist who was like, your ovaries are done, lady, like let it go. And I was shocked because I knew that I was going to have problems, but I did not know that like at 34, I could effectively be going through menopause. Like that was mind blowing to me. And I had so many problems and so much pain. I was like, okay, well, if I can't have kids and my uterus and my ovaries are causing me nothing but pain and suffering, I just want them out. And he was like, I completely agree. So it wasn't like cancer or anything where I had to have them removed, but it was causing me so much physical pain that I took it off. And he was actually the one that was saying, hey, you should really get into hormone replacement therapy. So I was really fortunate that I had somebody who was kind of forward thinking and understood the benefits of that.
That is wonderful. Because I'll tell you that most docs that perform hysterectomies do not put women on hormones. And it's devastating for them. Devastating. Like, I don't care what anybody says. You take those parts out of a woman, she does not feel complete. And I've had woman after woman after woman tell me that. How are you changing? And to not be able to produce those hormones or get them replaced, I think is evil. Because your body's so used to having that and needing that. Your body is designed to have testosterone. Your body is designed to have estrogen. the latest research shows that estrogen is breast protective, brain protective, heart protective, bone protective, vagina protective. It helps so many things, and you need to have it. So anyway, that's my soapbox. I think,
Yeah.
especially with people that are forced to have a hysterectomy because of cancer or something like that.
Yeah, I think it's
Important
such
to
a
replace
shame
hormones.
because it's like, okay, so now at 35 or whatever, you've basically got to go through menopause, which you can see women that are like in their 50s or whatever that go through natural menopause at like a normal time and the decline that their body goes into. And I'm sure that there is some form of diet and exercise and all that that you can kind of stave that off, but it's still a decline, right? There's a reason that we are frail and our bones get brittle and all this other stuff as we get older. And now you're telling them start that process at 35, but we expect you to live till 80, 90. And it's like, do you really want that portion of your life feeling like you're 90 years old every day? Like that just seems like unconscionable to me, where you're basically giving these women like a death sentence of their like health and well-being for that portion of their life. It's just such a shame. So I definitely want to be able to give you like that opportunity to encourage women to at least get it checked, right? Like if you're normal, you're normal, but if you're not, do something.
Yeah, and there's a lot of people that do this in the country. I recommend effective health providers because I feel like they educate their providers the best. Get your labs checked. Get your total and free testosterone checked. Figure out where you are at, whether you're transitioning or you're still having this, what your body is doing. It could change your life. And then put a value on that. What is it worth to you to have your life changed? I mean, what is it worth to you? I mean, it's life changing for you.
Absolutely.
Sorry.
No worries. So no, yeah, I agree. Like, we always joke and say as we were getting older, like, oh, if you could just take a pill, like what would you pay for a pill that would make you have more energy, eat whatever you want? And okay, with a grain of salt, right? Like I'm not going to go out and eat McDonald's every single day for every single meal, but I can eat the things that I couldn't eat before without gaining massive amounts of weight and not being able to lose it. And I have the energy to chase my son around. I'm sleeping better at night. It's like, what would you pay to do that? And it far exceeds what I actually do pay. And it's life-changing. So, yeah, ladies, if you are feeling tired, emotionally unstable, if you're gaining weight and can't lose it, no matter how much you exercise or diet, if your sex life is suffering, if you've got dryness, if you've got what other symptoms am I missing, Phil? I know I'm missing something.
Cold hands and feet, GI issues, hair falling out. I can keep on going. Brittle nails. There's so many. It impacts your whole life. Obviously the brain fog, the exhaustion. Walking into the kitchen and forgetting why you walked into the kitchen. I mean, that's it.
Yeah.
And this is not just for women. This is for your husbands too. Like my own life. I'll tell just real quick my own story with testosterone. I was 34 years old. I was 40 pounds heavier. My wife came to me and she was in her third trimester with her third pregnancy. And she basically asked me, what the heck is wrong with you? You're sleeping all the time. You're exhausted. You have no libido. And I had no answer for her. None. And so I went on a mission, went to multiple primary care providers. They told me my testosterone level was normal. And normal is not normal. We don't account for age at all, especially when it comes to men's hormones. So normal is 300 to 1200. I had the testosterone of a 60-year-old man. So once I was treated and brought to optimal levels, my whole life changed. I feel the best I've ever felt in my life. I feel like an 18-year-old again. To have that, it's like a new view on life, like being handed my life back. And knowing that I'm not going to have any more kids, because that's a big issue, especially when treating men, because it makes you less fertile. This is like heaven for me. I'm going to feel great the rest of my life. I will never come off testosterone. People ask me, you're 36 years old. you don't need testosterone. I'm like, I can't live without it.
Yeah.
I don't want to live without it because I know what it feels like. It feels awesome, and the risks are very low.
Yeah.
So
Awesome.
anyway,
Thank you for
there's
sharing
my
that.
soapbox.
Yeah, no, I completely agree. And I want to encourage everybody out there that is going through all of those things and wondering like, is this just it? Like, do I just have to power through the rest of my life? No, you do not. Definitely get your hormones checked and check out Avexipel. I'm a big fan, but I'm sure there's other, other providers, other people out there. I just personally like Avexipel, and Phil and his team have been amazing in helping me feel and look my best. And ladies, I just want to, if you're tired, if you're exhausted, if you're mental foggy and you just don't know how to like cope with day-to-day life, definitely do this. It's been life-changing for me, and I certainly want to share that with you guys. So Phil, is there anything else that you want to say before I end our nice little chat?
No, if you're in Arizona, come see me. We have 3 locations.
Definitely. 3 locations.
Prescott, Gilbert, and Fountain Hills. So we'll be doing pelleting at all of those. We primarily do hormones right now out of Prescott, but we are getting up to speed in Gilbert and Fountain Hills, so down there.
That's great. And I'll be including your website on your show notes page. So anybody that is listening to this, you can go to momsloveguns.com, check out the podcast episodes page. You can see Phil's specific podcast episode page, and there'll be links to his website and kind of everything that he does right there. Phil, thank you so much for your time. I really appreciate it. Thank you for giving me my life back. I am very appreciative of that. Ladies, tough mothers out there, if you have any inkling that you might have some hormone imbalances, I urge you to go out and get it checked, and go out there and be not afraid. Great job. You made it to the end. You are one tough mother. If you enjoyed this podcast and want to support the work that we do and keep the good loving coming, subscribe, rate, and review on iTunes, Spotify, wherever you're listening. What's that? You're one of those crazy mother followers that wants more of this nonsense? You got it. Subscribe to the Moms Love Guns YouTube channel, follow us at Moms Love Guns on Instagram, and join our free private Facebook group to connect with other women just like you in an encouraging and non-judgmental community. If you want to share even more love, share your new favorite community with a friend or all of your friends, maybe even a few enemies, just to be safe. Get out there, overcome your fears, be not afraid. You have got this.